46 years old and aging fast. Am I a good candidate for neck lift, chin implant, and upper eyes? Do you think I am a good candidate for these procedures? Would they be the most suitable? I have always had a weak double chin. I am not overweight, but feel like this neck makes me appear that I am. I have been contemplating on this for over 5 years.
Thank you for your question. You're 46 years old and you feel like you're aging fast, and you're asking about a chin implant, upper eyelids, neck lift. So certainly in a practice like mine, I'm a cosmetic, oculofacial, plastic and reconstructive surgeon, and also board certified full body cosmetic surgeon in practice for over 20 years in Manhattan and Long Island. I get to hear this a lot. I see patients every day, and because I've been in practice this long, a lot of my patients have been with me for 10 years, 5 years, 20 years, and so we've all gotten older together, and we'll review pictures, and a lot of times it really feels that way because a few years can make a difference. The genetics of aging is what it is, and even with good healthy habits and things like that, there's things that are programmed into your DNA that occur and make you feel like you suddenly look older. A lot of my patients, women will say, I looked in the mirror and I'm starting to look like my mother, and they don't mean that in a good way. So it is certainly understandable that you're exploring these options, and in a way you've almost prescribed for yourself, based on, I'm sure, extensive research, the things that we do as cosmetic surgeons to help people with situations like yourself. So to answer the questions of the upper eyelids, it's very straightforward that you do have hooding in your upper eyelids, so there probably would be benefit to a cosmetic upper eyelid blepharoplasty. The key for you is, especially when you are in your mid-40s, where you don't want to look older by having cosmetic surgery. This is a common fear. People see celebrities all the time who overdo their procedures, and a lot of times younger people can have procedures and then they look like they're older people trying to look like someone younger. There really is more than ever a need for the doctor and the patient to understand the art and the balance. We have so much technology and so much available to us, and so many people who perform these types of procedures, that patients need to really seek out a doctor who resonates with their aesthetic, with their values, with their style. So with the upper eyelids, I would say it would be more on a conservative side. I would review maybe some photos with you, and we try to understand what would look natural for you. A lot of times, even though it's a cliche, less is more, that doing enough so that your eyes look a little brighter rather than doing it more aggressively so that you don't have any volume over your eyes. As far as the chin implant is concerned, based on your profile, a chin implant might really do a lot of good for you. Evaluating you for a chin implant would also see if you have a deep underbite. You know, sometimes when there's an underbite, the chin is really back, and a chin implant can be an option, but it still has to be relative to how much back the jaw is. A lot of times people just have a relatively weak chin, and so a chin implant not only gives you a good projection from the side, but actually lengthens the face and adds balance from the upper, middle, and lower thirds of the face. As far as neck lifting is concerned, you know, with the chin implant, it is possible that you would possibly get enough projection that you may not be as bothered by the amount of skin under your chin. This requires physical examination to make this determination. I'll often, sit with the patient and actually pull the skin up and see how the skin moves and whether or not it's of any value. Sometimes when people have a relatively weak chin and a little bit of skin under this chin, if you lift and push the skin, there's not much to move. And if that's the case, then I generally advise to wait before having a face and neck lift. So with an understanding that you're probably a good candidate for the upper lids and the chin implant, I would advise meeting with qualified, experienced cosmetic surgeons and people who you feel comfortable with, who resonate with your aesthetic. Other things to look for, the types of anesthesia. In our practice, we do these procedures. We do pretty much every procedure under local anesthesia with IV sedation, which has been really exceptional for us because our patients are recovering faster. And even when we do eyelids, facelift, chin implants, and all multiple procedures on the face, a week later, people can look really good and be able to, with a little bit of makeup, just get back to work. So anesthesia is important. I tend to feel that people who go under general anesthesia tend to have longer recovery periods and have more issues with postoperative nausea and vomiting, etc. But most importantly is the aesthetic style of the doctor and the kind of relationship you have and understanding. You know, 40s is a time where facial aging changes do occur, but it is so critically important that these decisions be made with care so that you don't have too much or too little done. With many devices that claim to create surgical results, which they don't, it's also tempting to try those out, and patients waste a lot of money having procedures with devices that are supposed to heat up the skin and lift it, and they just simply consistently don't work. So again, meet with qualified, experienced cosmetic surgeons and get a sense of what their perspective is. Make sure you have a good communication with your doctor and you're comfortable with the procedure, the anesthesia, and the recovery period, and most importantly, the details of your outcome. So I hope that was helpful. I wish you the best of luck, and thank you for your question.